Barakata Yahweh, Barakata Yahusha, Barakata Yahweh, Barakata Yahusha, Bahashim, Rakakwadash. Double honor to the apostles, the elders, salutations to you, sincere brothers, teaching in truth and in sincerity. This lesson will be entitled Current Event, a Pursuit for Their Success.
I don't vape. I borrowed this to prove a point. Step 1. Wear a mask. Step 2. Biometric vaccine. Step 3. Cashless society. Your world leaders are lying to you.
My source, RT.com, and this article is entitled 5 Reasons Why England's New Coronavirus Lockdown is Not Justified. This article was published on the 3rd of November 2020. But do the facts really justify this damaging new shutdown of the country's economy? Or is Johnson basing his decisions on the same advice from the same advisors who frankly got it wrong last time? Let's take a sober assessment of the evidence. 1. Cases are not surging. In his summary of the evidence, the chief scientific advisor, Sir Patrick Vallance, provided a wide range of estimates for the daily incidence of COVID-19 in England, suggesting it could be anything from 38,500 to 105,000, based on 3 different sources. According to government estimates approved by the Scientific Advisory Group on Emergencies, the number of cases has been rising between 2% and 4% per day. The now magical R number has fallen to between 1.1 and 1.3. In other words, 10 infected people are on average infecting between 11 and 13 other people. Far from cases surging, they appear to be rising either quite slowly now or hitting a plateau. Two, forecasting is hard, but these are absurd. Given that the actual data doesn't look that scary, Vallance switched to talking about models, all of these winter scenarios, assuming that there are no changes in policy or behavior, suggested we could expect far higher numbers of deaths. One model produced by Public Health England and Cambridge University attracted particular attention because it suggested that up to 4,000 people could be dying each day by mid-December if action were not taken. But as has been revealed since the news conference, the results from the most alarming models are 3 weeks old, and were predicting that by now we would be seeing as many as 1,000 deaths per day. In fact, the highest recent seven-day average figure for daily deaths was 219 in the week up to the 30th of October. That figure may get revised upwards a little, but clearly the figures from this model are absurd. Even the model figures from other sources seem to show double the number of actual deaths. And I wonder why. 3, it may not all be COVID-19. Even the reported number of deaths is open to question. It is still not clear if all of these people died because of COVID 19 or simply had a positive test result, but actually died from something else. Certainly, the vast majority of people dying are old and have other serious medical problems like dementia or heart disease. But what could the something else be that could be mistaken for COVID? What is striking, as reported by RT last week, is the disappearance of influenza. Flu cases have dropped by 98% in the UK and disappeared almost completely in the southern hemisphere. Winter. It seems at least possible that some of the deaths attributed to COVID 19 were in fact false positives and were actually caused by influenza. 4. Hospitals are not in danger of being overwhelmed. The mantra throughout the crisis in the UK has been protect the NHS. It is obviously wise to ensure that we don't get to the point where there are so many COVID patients that some get left untreated. In northern England, some hospitals do appear to be under serious pressure, but few have reached the peak levels seen in the spring. In the apparent absence of influenza cases, fears of double trouble in hospitals, a flu outbreak, and COVID epidemic simultaneously have not transpired. And it states, meanwhile, in many other parts of the country, the number of patients in hospitals is well below the spring peak. For example, in London, there were 921 patients with COVID 19 in hospital on the 1st of November, compared to 4,813 on the 8th of April. And the rate of increase looks comparatively gradual. In the Midlands, the growth rate is higher, but there were still only 1,764 patients on the 1st of November compared to 3,101 on the 10th of April. Five, the cure is likely to be worse than the disease. Meanwhile, the damage from another lockdown will be enormous. No assessment of its impact has apparently been done by the government. But we know that businesses that have struggled to survive will go bankrupt. Social isolation will increase. Suicides will spike again. People who should be going to hospital will put off doing so until it is too late for fear of stretching the NHS too far. That's despite the fact that even routine surgery is still mostly going ahead as planned in the busiest hospitals. Johnson was quite right to take a regional approach to restrictions when it is clear that many parts of the country are seeing much lower rates of infection than in the hot spots. It states the Prime Minister seems to have panicked, acting like a driver who has been unable to work out how to control his vehicle and has decided that there is no option but to slam into a lamppost to stop it. The only compliance from the official opposition, Labour, has been that the crashing of the car didn't take place 3 weeks ago. There's a big danger that decisions are being made in a groupthink bubble in Whitehall. We desperately need more critical voices in positions of influence if we are to save our economy, our lives, and our freedom. All of your so-called leaders report to the international bankers. Okay. COVID-19 is nothing but a pandemic. For Job 5:12, he disappointeth the devices of the crafty. A device of the crafty is what? COVID-19. Crafty, referring to the international bankers that control this entire system. The he, which is most importantly, is referring to Yahweh, Ba'ashem, Yahushua, so that their hands, meaning their might or their control, cannot perform, meaning attain, their enterprise. Enterprise in the Hebrew is going into their success, referring to what? The New World Order. Okay. Second Corinthians 2:11 leads Satan and Satan's physical manifestation on earth are the Edomites, beginning with the nobility of Edom, referring to the international bankers, should get an advantage of us, right? And one way they are attempting to take an advantage of us is the pandemic, COVID-19. For we are not ignorant, meaning what? We know, due to the Holy Spirit of his devices, and therefore we know that COVID is nothing but a device being utilized for the attainment of their success, which is the New World Order. Revelation 12:12. Therefore rejoice, ye heavens, and ye that dwell in them. Woe to the inhabitants of the earth, meaning everybody, and of the sea, for the devil is come down unto you. The devil, referring to the nation of Edom. Okay, beginning with their nobility. And nobility means highborn, having great wrath. It is about to get ugly. All right. And Jake, most importantly, we have to endure Jacob's trouble. And when you go into that term trouble in the Hebrew, it means straight, meaning what? The Most High will place us in a position or positions of difficulties, okay? However, Lord will, we are the elect. We will be taken care of, okay? Because he know that he have but a short time. That's right. See, the elite bankers consult with these demons on the left-hand side of the Most High. And also, they see the prophets. They watch the videos. They see the chariots. They see the signs of times. They know what's going down. They know. They know the second coming of Yahushua is approaching. And what brings us closer to the second coming of Yahushua is day by day, hour by hour, minute by minute, second by second. I think this is a good stopping point. Hey, Lord, will you're edified. Shalom.